In January 2020, I started a new job and got what I had wanted for years, an office with a window. Unfortunately, in March, a mere 7 weeks later, my work project stopped and I began work from home. But the new project I began was so topical and so interesting, I put aside my grievances with losing my lovely office and window to the side. This project focused on COVID-19 and the Irish National Ambulance Service, in particular supporting and informing healthcare workers and ambulance personnel. The ambulance service are at the forefront of the pandemic response, involved in assessing, treating, transporting and importantly testing COVID-19 patients. They faced unprecedented times, an overload of information from news articles, government web pages, journals and media. They needed up-to-date information on all things COVID-19, they needed to learn from other ambulance services worldwide to find out what they were doing, and importantly, they needed to evaluate their own adaptive practice and response, so when future waves or pandemics of this nature emerged, they knew what was going to work. How could we achieve this? The first thing our project did was create a weekly international updates newsletter that gathered ambulance-related information worldwide from peer-reviewed journals, government web pages, ambulance, news and social media sites. We shared this with ambulance managers and staff. Readers of the newsletter found it clear and informative, and many shared it with their colleagues and within their organisations. Secondly, we created an international network of senior ambulance personnel from 12 countries to learn and share experience of how ambulance services were responding to the pandemic. We helped to share information among international ambulance personnel about PPE practices, COVID-19 testing of ambulance staff, and many other informative topics. Lastly, to underpin our entire project, we needed to create an evaluation framework that could be adopted by the ambulance service to help them assess their pandemic response and learn about what they did well and didn't do well. We searched for evaluation tools and methods and conducted interviews with staff members working in the COVID response room, a centre that managed referrals and organised home testing for patients at home and individuals living or working in residential facilities. These interviews provided a robust qualitative investigation of quality improvement and leadership approaches during this time. They helped us to develop a framework that could be used in future waves or pandemics, as well as future practice to facilitate evaluation on an ongoing basis. Nearly 2 years later, we hope this pandemic is a once-in-a-lifetime event. The WHO suggests this is unlikely. For that reason, our 3 key takeaways from this research include developing robust, useful and evidence-based communication, information sharing and evaluation methods. This is an important legacy to create in case of future pandemics. Outputs from this project could encourage the ambulance or wider health service to adopt evaluation routinely in their practice, improve communication channels and generate information sharing networks to learn from other national and international colleagues. The nature of the pandemic was rapid. Rapid changes to health services, rapid adoption of new practices, rapid sharing of information to learn about all things COVID-19, and rapid evaluation to learn from these changes and better prepare us for the future. All of these things can be implemented successfully if we communicate, share and evaluate along the way. And I may possibly make it back to my office and window. Thank you.